Hello everyone, and welcome to Session 3 of the Global Black Feminist Reading Circle. My name is Randy Henderson, and I am one of the Black Feminist Reading Circle members of this online group. This session runs from January 20th until June 2nd and includes 2 week-long breaks. Our democratically selected reading material is Harriet A. Washington's book, Medical Apartheid, The Dark History of Medical Experimentation on Black Americans from Colonial Times to the Present. Our book group meets each Tuesday evening from 6:30 to 8 on the Google Plus Hangouts on Air platform. You may find the Global Black Feminist Reader Circle on Google Plus, YouTube, and Facebook, and always feel free to join us in reading our story together.
Welcome everybody to the Global Black Feminist Reading Circle, where we are reading for change. We are all in a good mood and happy tonight because we are closing the book on Harriet A. Washington's Medical Apartheid, The Dark History. She ain't never lied. The dark history.
Yes.
Of medical experimentation on Black Americans from colonial times to the present. We actually finished reading last week. You are invited to join our community on Google Plus, or follow our Facebook page, or look up the hundreds of videos that are archived on YouTube under the name the Global Black Feminist Reading Circle. And my name is Michelle Odom. I'm one of the co-hosts of the group, along with Randy Henderson, who will join us shortly. And I'm located in Brooklyn, New York.
I'm Thaddeus John Bell, and I'm a practicing physician in Charleston, South Carolina. And one of my passions is dealing with health disparities that affect African Americans and the underserved.
I'm Joel JJ, hailing you from Charleston, South Carolina. I'm glad to be here amongst all the women and one other man.
Let's stay in the South, Georgette.
Okay, my name is Georgette Moses, and I'm in Columbia, South Carolina. And I'm happy to see everyone here, and I'm ready to decompress.
All right. And the extreme north, Vanita.
Good evening. My name is Vanita Walker, and I'm joining you from Cromwell, Connecticut, which is the extreme north of Connecticut, right before you hit Massachusetts. Welcome.
And finally, Kim.
Hi everybody, I'm Kim Brandon, and I'm also in New York City, and looking forward to this conversation.
Thank you.
Hi, my name is Randy. I'm watching from Atlanta, and I'm happy to see everyone.
I think most of us are going to need some time to kind of process our fear before we're ready to pursue. But just in terms of going to the doctor, you go to the doctor and you bring all this fear, you know, but you need the care. Are there like general questions that we should always ask, like, why are you prescribing me this medicine, or you know what are?
But you know, that's an excellent question. That's what Closing the Gap in Healthcare tries to do. Okay. African Americans bring a lot of myths and untruths to the table when it comes to medication. Case in point, just yesterday, a young girl that I've been seeing for about, I saw her for another issue, and I noticed that her blood pressure had been elevated. And it was significantly elevated from the time that I saw her 6 months ago. So I told her that I thought she had high blood pressure based on the blood pressure that I was seeing. And you know what she told me? I told her that, I said, well, here's some things that I want you to do before you come back to me the next time. Well, she came back to me and she told me that she decided that she was going to take some vinegar for her blood pressure because her mother and her grandmother told her that vinegar made high blood pressure go away. Okay? And that's what she wanted to do. So I had to sit down and explain to her that vinegar does not make people's high blood pressure go away. And one of the reasons that African Americans have more strokes and heart attacks than any other group of people is because they bring a lot of fears and untruths about medicine. Medicines work. I don't know what kind of doctor you're going to, but in South Carolina, we have very, very strict rules about quackery. All right. One of the problems that I have learned from dealing with the health disparities, and Jazzy will, I hope that Jazzy will get a chance to share with you some of the health tips because we address this issue very, very upfront. We try to help African Americans get rid of the truths and misconceptions and stuff that they get from their family members that cause us to live a poor quality of life than our white counterparts. So sometimes our worst enemy can be ourselves. Now, how many people do you know are supposed to be on blood pressure medicines and stop the blood pressure medicines because the blood pressure pills ran out and they thought the blood pressure had gone away? Those are the people that end up in the hospital with strokes and heart attacks, not because the medicine didn't work, but because they thought something entirely different. So that's what Closing the Gap in Healthcare try to do. We try to educate our people about the do's and don'ts, the kind of crazy things that they have been taught over the years, and we try to bring them into the 21st century and say, look, if the doctor diagnosed you with hypertension, you're probably going to have that for the rest of your life. You're going to have to take these pills for the rest of your life. And if you don't, you're going to have a heart attack, you're going to have a stroke, or your kidney's going to go bad. And that is one of the reasons why African Americans lead, in South Carolina, we lead any other group of people in having renal failure and having dialysis. And the reason why is because somebody, I hope that somebody has given them this information, but for some reason or another, they stopped taking the medication because their cousin told them something different. They didn't trust what the doctor was telling them. So lots of times we can be our own worst enemy. And it's because of a lot of stuff that we've heard from our relatives and et cetera in the past. So
Hey,
that's
Dr.
why
Bell.
if you choose the doctor, trust what your doctor is telling you. I mean, you chose him, so apparently you must have some confidence.
Well, really, no. One of the concerns that we have, and I think I've heard most of us express it here, is that we feel like our time with the doctor is so limited, that the doctor's always in a rush. You know, he's trying to see 100 patients today, and even if you have the courage, because it takes a certain amount of courage to talk to a
I only
doctor.
saw 12 patients today. Doctors don't do that. Jasmine can tell you that. That doesn't work in my practice. Go ahead.
But
Dr. Bell, you have a unique practice, but I think what you're trying to say is, you're not attached to the corporate you know, and a lot of doctors can't do like you do because a lot of doctors are working for a big health conglomerate. But I think what she's trying to say is, how do we get the best out of the system from an educated point of view? How do we push these people that may or may not have certain biases about African Americans? How do we be a smart shopper or smart patient when it comes to a doctor? How do we make most of that 12 minutes that they're going to give us?
Okay, the way that you do that, if you have high blood pressure, you go online and you read about high blood pressure. You read about what will happen if you don't take your medications. You read about, you read, if the doctor tells you that he's going to give you a certain drug, you go online and you read about that drug. You read about the side effects of the drug. All right? That's the way that you protect yourself. You're right. Doctors only have about, at best, 10 minutes to be with a patient. Okay? That's just the way it is. That's not going to change. But I would encourage, for those of you, if you have a medical problem, read. If you have diabetes, go online and read about diabetes. And then I think a lot of the things that the doctor tells you will make sense when you hear it. But I can appreciate that. And I hate to keep mentioning closing the gap, but that's one of the things that we do on radio and television every day. We talk about issues that come up in the doctor's office that your doctor may not have explained to you. And I explain it in a way in which you can understand it, and hopefully in a way that's culturally sensitive, and in a way that you can remember it. Okay? But becoming educated about your medical issue. I think Jazzy has heard me talk, as I mentioned to you earlier, my daughter passed away from cancer 3 months ago. But about a month before she passed away, I went to the doctor with her, and I was blown away at how intelligent she was about the cancer and the treatment and the drugs that were getting ready to come down the pipe, and etc. I was just blown away that she was just so informed about her illness. And of course, one of the things that I can tell you, when you are informed about your illness,
Yes.
you get the doctor's attention.
That's right.
Okay? You get the doctor's attention when you know something about your illness. And sometimes you may have to go to the doctor just to ask a question. You don't have to go to the doctor just to be sick all the time. You may have to go just to make sure you got a clear understanding of what's going on. For an example, if you have high blood pressure and you walk in the doctor's office and the doctor tells you your blood pressure is elevated, what's the first question that you should ask him?
Why?
If I say to you, your blood pressure is elevated.
Why? I don't know. Why do I have high blood? Yeah.
Why is my blood pressure elevated? Well, now, there are a lot of reasons that people's blood pressure is elevated when they're on medications. What do you think is the main one?
Stress.
No. If you're on medication and you come to the doctor's office and the blood pressure is elevated, what's the main reason that it's still elevated?
Side effects.
You're not taking it correctly.
You're not taking it.
Okay.
You're not taking it. You let it run out. Your friend told you that you didn't need to take it no more, and you just stopped taking it. And then to make matters worse, you tell the doctor you are taking it.